So today we're going to tell you a little bit about McKenzie neck exercises. We're going to show you two that we commonly give out, and then we're going to tell you why they may not be working for you. So stay tuned. So a lot of people come here, a lot of people are used to the McKenzie back exercises. There are also a series of McKenzie neck exercises. That's based on an evaluation, a McKenzie evaluation. We often come up with a couple that commonly are used in the clinic. The first one is a cervical retraction. The second one is a cervical retraction with extension. They're by no means the only exercises that you'll see someone receive in the clinic here, but they're two of the most common ones that you'll see given out. And they're supposed to help you with neck pain. You could also have shoulder pain or elbow pain. Sometimes you don't even have neck pain, you have extremity pain. It's actually related to your neck, which we talked about in another video. So today, we're going to show you those two exercises right now and what we normally tell people. And then we're going to tell you the reasons why they may not be working, because it's really important that you understand that, because you may throw it out throughout the exercise, say it's not right for me. Actuality, you just missed a couple little points. All right, so let's first talk about the two exercises. First one is called the cervical retraction. Okay, so we're going to sit up nice and tall. We're going to bring our chin straight back, and then relax. You can use your finger, you can use the web space of your hand, like that. That's the first one. Second one is a retraction, and then you're gonna look up to the ceiling and do a little wiggle, okay? Typically you'll have a loss of motion in those two directions. If you have a loss of motion, that's one of the indications that you may wanna do those exercises. So why do these exercises sometimes you don't have success? It doesn't get rid of the pain. You still don't have the mobility you thought you get. You're still uncomfortable turning your head side to side. There's a few things that you will have to look at and really pay attention to. Okay, so the first thing we're going to look at is our setup. We have to make sure we're starting correctly. So if you're sitting on your bed or something like that, you've got to make sure that you're nice and upright. You've got a little indent in your back. Your ears are over the tip of your shoulder, and sometimes if you have loss of motion, you can't do this one. It might be a little hard to start the exercise, but as much as you can, think of chest up like this and start the retraction from here. That goes true with the retraction with extension as well. If we start forward, we get more of a bunching, and most times it makes it worse. So that's a big thing, is people start out, they just start doing this and they're kind of leaning forward. So make sure you start out with a good starting position, nice and upright. Sometimes I have some people sit in a chair so their back is kind of positioned so they don't lean back as well. All the motion when they're doing the exercise is from here, not from leaning back and forth or not because of poor position. Most times it just doesn't feel good. You'll know something's not right. Stop that. Second one is we're just not doing enough. A lot of people say, hey, I did that exercise a couple times, didn't work. There's oftentimes a cumulative effect. You need to do this exercise a lot. One of the two that I just showed you, and if you do it enough, that's when it takes hold. I mean, a common thing is to tell people do it 10 to 20 times every 2 hours. So you want to get at least 5 sessions in during the day. If you spread it out through the day, it's much more effective than cramming. Let's say I'm going to do all these exercises at the end of the night, or start out the day doing 100. You just tolerate it better. It also reminds you a little bit about your posture when you do it throughout the day. So you want to do 10 to 20 times, at least every 2 hours. And you have to do it for a few days to see a pattern. Some of you people have been working on this for a while. You need to kind of work on that range of motion for a while before you give up on it. Okay, consider that. Another thing that happens is a lot of people, a fair amount, will feel like, wow, I'm getting my pain. It's actually painful when I do the retraction and extension. It's all right if you have pain for the most part, as long as it doesn't worsen. If you have central neck pain, it doesn't start radiating down your arm. That's obviously pain we want to avoid. But if we just have pain in the area we're thinking about, and it's actually getting smaller or becoming more central, but then kind of going more to this area, let's say it's out into the upper trap area, and then as you do it, it's painful when you do it, but when you get done, it's more in the center and it's less spread out. That's generally a sign that we want to keep on doing that movement. But a lot of people abandon it and say, it's painful, I got to stop. Another thing that kind of comes up is they start saying, I'm getting a different pain, I'm kind of getting a little sore or stiff. that's not always an indication to stop. It might just be that you're moving into a new position that you haven't been in for a while. Last, you actually might not be getting to end range. Some people are nervous about moving, especially, this isn't a common thing you do, moving your head back or moving your head back and up. So people will short it. What I mean by shorting it is they kind of stop before they get to the very end of the motion. They don't get to the very end where you physically can't move anymore. It's like trying to stretch something without putting tension on a muscle, or trying to push something without making contact with it. You've got to get to the point where that joint doesn't move anymore. At the end, pressure on, pressure off, okay? 1 or 2 seconds, and then take pressure off. So I have a lot of people, they get nervous. They say, oh no, it's starting to hurt. Is that as far as you can go? And then they'll go, oh, now I can go further. Boom, that's where the magic happens, at that last little bit. So make sure you're getting to the very end of the motion. But well, it shouldn't make it worse overall. Like very soon after doing these exercises, it should change the symptoms in a positive way, or at least neutral. But it should never make it worse. If it's making it worse, you may need a formal evaluation for this. But let's get to the very end range of that joint. You do need that extra pressure like this through your hand when you do the retraction. And when you look up, the little wiggle is a little extra pressure when you're holding your head back. The weight of the head creates a stretch, and that little extra wiggle will create the stretch you need, okay? So I hope this helps you out and gives you a little more information on maybe something that you might be doing that's just, not correct, and maybe you've got the right exercise, but you're just missing a couple points. So I hope this helps you out. You start seeing an improvement. Hey, if you got a lot out of this, hey, subscribe to our channel. Hit notifications on so you hear about future videos, and share it with someone that might have a problem. It may help them out. Wouldn't it be great to avoid going to the ER or getting nervous about it? Try these exercises, but make these little changes, and let's see if it helps you out today. Have a great one.